Imagine starting your day with the revelation that a simple MRI scan could predict your risk of a heart attack or stroke up to 10 years in advance. A recent study from the University of Dundee suggests just that. But how does that actually work? Well, let's dive into the details. Currently, MRIs are not a recommended screening tool for asymptomatic persons. However, recent cohort studies have demonstrated that cardiac MRI can detect subclinical disease, such as silent myocardial ischemia, unrecognized myocardial infarctions or old heart attacks, increased carotid wall volume, and subclinical atherosclerosis or plaque buildup, which are independently associated with future major adverse cardiac events. In individuals who have increased risk for heart disease or multiple risk factors and no known cardiovascular disease, cardiac MRI can provide high-resolution assessment of cardiac structure, function, tissue characterization, and can identify early myocardial or vascular changes. These are clinically significant because they can be used to predict your heart risk or your cardiovascular risk. Researchers at the University of Dundee have conducted a study involving 5,000 or so patients, all over 40 years old, without any history of heart disease between 2008 and 2013. These volunteers underwent MRI scans focusing on the heart's left ventricle. That's the main chamber responsible for pumping blood to the entire body. The study found that an increased left ventricle could indicate the future cardiovascular risk or an event, even when the heart was functioning correctly and at the time of assessment, there was nothing structurally abnormal. Interestingly, the study revealed gender-specific risk factors. In men, a larger left ventricle correlated with higher diastolic blood pressure. That's the lower number. Where in women, it was linked to elevated cholesterol levels. This study emphasizes the potential of MRI scans as a predictive tool for cardiovascular events. Early preventive strategies reduce risk of heart attack and stroke. We know this. Despite these capabilities, the incremental prognostic value of cardiac MRI over traditional risk scores, like the Framingham, the Interheart, the Prevent, is most pronounced in selected high-risk patients who are asymptomatic and not the general population. So while more research is needed to integrate this approach into the routine clinical care and practice of all comers, this is important research that we can potentially use for prevention. And as always, consult with your doctor and your healthcare provider about the latest strategies to monitor and maintain your heart health. If you want to keep learning, I will include links to videos somewhere on the screen here, so click the links to follow.